That heaviness in your legs right now, the one you've been blaming on a long day, on getting older, on standing too much. I need you to stop and pay attention to it. Because in my 4 decades as an endocrinologist, I have sat across from patients who ignored that exact feeling for years. And some of them didn't make it to my office in time. My name is Dr. Raymond Chen. I'm a board-certified endocrinologist and metabolic health specialist based in Scottsdale, Arizona. I've spent over 40 years watching what happens when the body sends quiet signals and nobody listens. Today I'm going to show you 7 specific sensations, things happening in your legs, your feet, your chest right now, that could be warning you about blocked arteries or failing veins. And I'll show you what to do about each one before it becomes a crisis. Don't go anywhere, because sign number 3 is the one that sends the most people to the emergency room without any warning. I need to tell you something I rarely say publicly. At 58 years old, I nearly died. Not from ignorance. I was one of the leading endocrinologists at a major hospital system in Arizona. I had published papers, I had prescribed thousands of medications, and I was still on a path straight toward a heart attack. My arteries were stiffening, my blood sugar was spiking. I was the doctor who didn't see it coming. That experience forced me to question everything I had been trained to do. It sent me to Taipei, where I recovered my great-grandfather's herbal medicine journals, a man who practiced medicine in a time before statins, before stents, before any of the interventions we rely on today. What I found in those journals and what I tested on myself over 4 months completely changed how I understand circulation and vascular health. I reversed every single marker, and now I teach the same principles to my patients. What I'm sharing today is not about selling you something. It's about giving you the knowledge that the system, the big food and big pharma pipeline, profits from keeping you without. So let's talk about what's actually happening inside your blood vessels right now. Your body has 2 separate highway systems running through it. Arteries carry oxygen-rich blood away from the heart, out to your legs, your feet, your brain, your organs. Veins carry that used blood back. Think of arteries like pressurized delivery trucks rushing outbound. Veins are the return lane, slower, lower pressure, relying on your leg muscles and tiny valves to push blood back uphill toward the heart. When either system gets compromised, your body starts sending signals. Most people miss them entirely, or they explain them away. Here are the 7 signals you cannot afford to ignore. The first is leg heaviness or fatigue that gets worse as the day goes on. Most people assume this is simply tiredness. Maybe they stood too long. Maybe they're out of shape. But here's what's actually happening. When the valves inside your veins begin to weaken, a condition called venous insufficiency, blood starts pooling in the lower legs instead of returning to the heart efficiently. Imagine a river with a damaged dam. Water backs up behind it, pressure builds, and the surrounding area floods. That flooding is what creates that deep, aching heaviness you feel by evening. A study published in the Journal of Vascular Surgery found that over 40% of adults over 60 show signs of venous insufficiency, and most have no idea. The simple daily habit here is elevating your legs above your heart for 10 minutes each evening. Not a luxury, a medical intervention. The second signal is cramping in the calf or thigh that comes on when you walk and disappears when you rest. This is called claudication, and it is one of the clearest early warning signs of peripheral artery disease, PAD. What's happening is that your arteries have narrowed enough that when your muscles demand more blood during movement, the supply can't keep up. Think of a garden hose with a partial kink in it. Water flows fine when you're barely using it, but open the tap all the way and the kink chokes the flow. That's your leg during a walk. The American Heart Association estimates that over 8 million Americans have PAD, and the majority are over 60. If you feel this pattern, pain with walking, relief with rest, please tell your doctor. That is not aging. That is a blockage in progress. The third signal, and I told you this one sends people to the emergency room, is a sudden coldness, paleness, or numbness in one foot or leg that wasn't there an hour ago. This is not the same as sleeping on your leg. This is your body telling you that blood supply to that limb has been acutely cut off. It could mean a clot has broken loose and lodged in a major artery. Doctors call this acute arterial occlusion, and it is a vascular emergency. The window to save that limb, sometimes even to save your life, can be as short as 6 hours. If you or someone near you experiences sudden one-sided coldness, sudden paleness, sudden loss of feeling in a foot or leg, you call emergency services immediately. You do not wait until morning. Now, before I continue, if what I'm sharing today is opening your eyes to something you've been feeling but dismissing, I want you to type the word circulation in the comments right now. It tells me this is reaching the people who need it most. The fourth signal is visible rope-like veins, swelling, or a brownish discoloration around the ankles. Most people think varicose veins are cosmetic. They are not. They are a visible sign that the venous return system is under serious stress. When veins lose their elasticity, like an old rubber band that can no longer snap back, blood pools, pressure builds, and over time, the skin around the ankle begins to change color and texture. That brownish stain is actually iron from red blood cells leaking into the tissue. If you see that discoloration, chronic venous disease has likely been progressing for years. The fifth signal is tingling, burning, or a pins and needles sensation in the feet, especially at night. Many of my patients assume this is nerve damage from diabetes, and sometimes it is, but poor circulation and nerve symptoms overlap significantly. When blood flow to the feet is compromised, the nerves in those tissues are starved of oxygen. Think of electrical wires with their protective coating slowly wearing away. The signals become erratic, tingling, burning, sometimes pain for no apparent reason. Research from the Cleveland Clinic suggests that up to 30% of people experiencing peripheral neuropathy symptoms also have measurable arterial narrowing contributing to those symptoms. The sixth signal is wounds or sores on the feet or lower legs that heal very slowly, or don't heal at all. This is one of the most dangerous signs of advanced vascular disease, and it is tragically common in people managing diabetes. When circulation is poor, your body simply cannot deliver the repair cells, the white blood cells, the oxygen that healing requires. A small cut becomes an ulcer becomes an infection. This is the pathway that leads to amputation. If you have diabetes, high blood pressure, or high cholesterol, and you notice a wound on your foot that isn't healing normally after 2 weeks, that is urgent. The seventh signal is shortness of breath or chest discomfort that comes on with mild activity. I want to be careful here because many conditions cause these symptoms. But when arterial narrowing extends to the coronary arteries, the vessels feeding the heart muscle itself, even moderate exertion can trigger a warning. The heart is asking for more blood than the narrowed pipes can deliver. This is called stable angina, and it is your body giving you a warning before the emergency. Let me tell you about Margaret. She was 71 years old when she came to my office in Scottsdale. She had been chalking up her leg heaviness to age for 3 years. Her feet tingled at night. She had a small sore on her left heel that had been there for 6 weeks. Her primary care doctor had told her it was dry skin. When I examined her circulation, her ankle brachial index, a simple pressure test, showed significant arterial compromise in both legs. She had been walking around with serious peripheral artery disease, completely undiagnosed. We caught it. We intervened. Today, Margaret walks her neighborhood every morning, and her wound healed completely within 8 weeks. I thought I was just getting old, she told me, her voice quiet. Nobody told me my body was trying to warn me. Here is what I want you to do this week. First, elevate your legs for 10 minutes every evening. Second, the next time you walk and feel calf cramping that eases when you stop, write it down and call your doctor. Third, look at your feet tonight. Really look. Check for color changes, temperature differences between left and right, slow healing spots. Fourth, ask your doctor about an ankle brachial index test if you have diabetes, high blood pressure, or high cholesterol. It costs almost nothing and can detect arterial disease years before a crisis. Please remember that this video is for educational purposes only and is not a substitute for professional medical advice from your own physician. Your body is speaking to you. The question is whether you're willing to listen before it has to scream. Type circulation in the comments if you learned something today. Share this video with someone you love, a spouse, a sibling, a friend who complains about their legs and doesn't know why. They may not know they need this yet. I'm Dr. Raymond Chen. Stay curious about your body. It's the only one you have.